Quiz for medical students, clinical case edition, duet and blind react. Let's see if you know the answer to the question. Okay, so a woman brings her 7-year-old child to the hospital. The woman is accompanied by her husband. She brings the child in for a clavicular fracture, and you take the child in the examination room to examine the patient. So the child doesn't talk very much. So you invite the mother in to ask the mother, like, what happened to your child? The mother tells you that he was playing football outside when he fell and broke his clavicle. So you let her go. And then after some time, you ask the father to come in. The father comes to the examination room and tells you that the boy was opening the fridge and the fridge hit his chest and broke his clavicle. And the father said he's not actually the father, he's the stepfather. So you let him go out. So you examine the child's body and you see abrasions that have recently healed. You see marks of wounds. You see burns on the child's skin. So as a medical doctor or resident, what would be your next step in this situation? Would you administer painkillers? What would you prescribe? Or what would you do? What would be your next step? You should call CPS, get the Child Protective Services involved. This is obviously a case of child abuse, and the first step is to report, because the stories from the mother and the stepfather are not matching. There's also a risk factor. The child is growing up with the stepfather, and you see the signs, the burns, which are possibly cigarette burns. You see the wounds from abuse. So report to CPS. Did you get the right answer? Don't forget to like and follow. Bye!